quality care services for the patients and for providing medical education. So, first of all, I would like to thank Team International Public Health Management and Development Program and Dr. Praveen Kumar, who is head of Advanced Pediatric Center and Neonatology Unit. They have provided us the opportunity to share our best nursing practices which are being practiced in our unit by us. So I would be talking about breast milk feeding for the preterm neonates. As we all know, preterm babies are babies who are born before completion of 37 weeks of gestation. So as they are born too small, they face many difficulties, like they are not mature enough to maintain their temperature, their respiratory centers are also not working well, and they face feeding difficulties because that maturity is not, they have not attained that maturity. For that they have a feed intolerance. Sometimes they are not able to gain weight, they are at risk of necrotizing enterocolitis. So, what should be the best choice to feed these babies?
No, from
Mother's own milk. Mother's own milk is our first preference to feed these babies. So, we all know the benefits of breast milk. It has various growth factors, immune factors, which provide optimal growth.
And the benefits for mothers also.
Yes.
And the benefits for mothers.
Right? These benefits are not limited to the baby only, but these benefits extend up to
And
mother and family, society
yes,
as well.
economic benefits.
So, if mother's milk is not available due to certain reasons, our next preference is to feed the baby through donor human milk. In our unit, we are having a human milk bank. So, if there is a shortage of expressed breast milk, mother is not able to send sufficient amount of feed for her baby. So, our human milk bank is available. It provides donor human milk to these babies to bridge the gap until the mother is able to fulfill the requirements of the baby. And the least preferred option is formula feed. So our hospital abides with IMS Act, and we use formula only under justified circumstances. Okay, so we strictly prohibit the use of formula feed.
So now
We do use
100% now. Breast milk?
no. Our first preference is mother's own milk. If it is not available, we are using donor human milk. And if the baby is not falling in the criteria of getting donor human milk and mother is also not well, only our last preference is to feed the baby with formula. There are certain indications when we can use formula. We are not using it blindly for every baby. Okay?
So how about sick baby?
Sick babies, we prefer to feed them with mother's milk. So how do we promote and ensure breast milk feeding in our unit? We conduct lactation rounds in our postnatal and neonatal units. We also check the records, intake output records, and we also see the recipient records, that how much is the gap between the demand and supply of breast milk. And we also inquire from the staff which is posted in the neonatal and postnatal units. So through all these sources we come to know about how much is the gap between the demand and supply. So let's talk about lactation rounds. We do 1:1 interaction. So lactation rounds help us to get the best opportunity to observe the mothers, assess their physical health, mental condition, type of support they are having from the family, and the level of their understanding, knowledge related to preterm care. So during our lactation rounds, we observe all these things and provide our skilled lactation counseling and guidance to the mothers. So during our lactation rounds, we teach and train the mothers for expression of breast milk, how to store it, how to transport it safely to the baby, and how to feed the baby safely. So our mothers mainly express through hands, And if they are having severe engorgement, we also provide them support to express through breast pumps, electronic breast pumps, which are available in our unit. During our lactation rounds, we provide the opportunity to mother to ask questions. So when they ask questions to us, we try to allay their anxiety and orient them towards the neonatal services and allow them to visit their babies, touch them, hold them, cuddle them, spend some time so that they don't feel scary about the environment of that intensive care unit. And during those visits, during those interactions, mothers are also provided opportunity to put their babies on breast for non-nutritive sucking or breastfeeding, and we also allow them to practice the mother care.
This is from the river.
And during our interaction with the mother, family is also present most of the times, and we advise the family members to provide good maternal nutrition, which is very important for the mother to maintain and initiate her lactation status, to improve her lactation status, and to provide rest and comfort measures to the mother, so that she feels more comfortable. She